Good morning. Welcome to the June meeting of the Disabilities and Conditions of Aging Network. If you are new to this network, it really was created out of a recognition that throughout COVID, lots of virtual networks focused on different needs popped up, but we didn't really see anything specific to disabilities, and recognizing that conditions of aging often present as disabilities, we felt it was important to include that as well. The network was initially created while I was doing outreach work for Advocates Personal Care, which is a great Medicaid waiver service provider that focuses on attendant care. But my contract with them on outreach closed, and I realized I needed to focus on developing Walking Spirit and my organization. So that is how we got to here, and the network came with me, and we really felt like it was more appropriate for it to be focused and hosted within an organization that is focused on improving access for people with disabilities. Services that I provide, you guys heard me talk about accessible DEIB a moment ago. Also do inspirational speaking about what it's like to acquire a disability, and apply that to whatever the audience is and their focus. And then the other service that I am offering, which is new, is a complimentary 1-hour consultation with any person with a disability or family affected by disabilities to talk about how you begin to adapt to those changes in your life. And if anybody is then interested in ongoing coaching, that is available for an hourly fee. So that's Walking Spirit in a nutshell. I have a few things to add, but I'm going to add those later. I want to first go around and give everybody an opportunity to introduce themselves and their organizations. Please share anything that you have going on that you need community support with or want to celebrate, or just simply want to engage and make certain we know about what's going on. And I will go to what on my screen is my left, which is Kendall Tilton with Noble. So Kendall, jump in.
Hi, I'm Kendall from Noble. I guess if you were here early, you might have heard on it. The most exciting thing for me right now is our Career Center will be opening at least by August. Probably sometime in July, we'll have a move-in. So that'll be at the Passage building at 50 South Shelby, right in the Englewood sort of area there. So we're very excited to be opening a new location there with a lot of our consolidated employment services. That's most of what I have.
Okay, very good. Jerika Barnett, and is it Danielle Benke with Hands and Autism?
Hi, sorry, it's Jerica, and yes, Danielle. So we're hands. So I'm specifically over group programming. I'm very new, so keep that in mind. I'll be doing seeing groups and things like that. So we have a variety of different groups that we offer for people in the community to attend, and depending on what their ages are, will depend on like the fee that they pay. So if they're pre-ETS age 14 to 22, it'll be free. And we're just now starting to focus on like a little bit younger. So we're starting to do groups from like 3 to 6 year old, and then 6 to 12, I think. And we also have a group on Fridays called Community Connections that's free for everybody in the community to attend, and we have a wide variety of ages that come to that. Trying to think, did I miss anything?
I think you covered it, and it's open enrollment for group participation, right?
Yes.
So that something to look for in terms of having more group participants that can join. They can we put our contact information, at least for Hands, into the chat so people can reach out and we can send out information. My name's Danielle Benke. I am still fairly new as well to Hands and Autism, but I am one of the transition support specialists. I work at our center, and I am I supervise our internship programs, which focuses on helping to provide job readiness for individuals with autism or other disabilities. Typically, we're working with our kids in that pre-eds age, that 14 to 22 transition, but we are able to help support others as appropriate. And they can also reach out if you have individuals that you know of that are interested. We will do open enrollment for internship programming to start in the fall. We are providing internship for this summer, and we have a small group of 6 individuals that are coming in a couple days a week to do internship programming at the center right now. But if there's questions, we're always happy to answer if anybody has anything.
Awesome. Are those paid internships or unpaid?
They're unpaid for individuals. So it is free, but for individuals that qualify, but it's unpaid. We do offer for individuals that are over the age of 18 and are appropriate. We have created a collaboration with Riley Hospital where they're doing some external volunteering experience to gain some additional experiences. But that they are currently unpaid.
Okay, very good. Do those, I mean, have you guys seen those lead into paid positions for folks who worked as interns?
I haven't been here long enough, unfortunately, to see that happen, but I know some individuals that have previously gone through internship with us have not necessarily fed through us, but have been able to gain employment outside of our organization.
Fair enough. I was just curious if you guys should maybe connect with Easter Seals Crossroads and their talent. I think they call it their talent showcase. That is really meant to connect folks who are seeking jobs with people who are wanting to specifically employ people with disabilities. But making them aware of your internship program would probably be a good thing. So
that's cool. Thank you for
yeah,
that.
and I don't see anybody from them on today, so that's why I thought I'd throw that in there. All right, James Michaels from Bosma, would you like to tell us what's going on in your part of the world?
Sure. Well, we just heard we received another 2-year grant cycle for our senior program. So that's where we serve seniors who are visually impaired over the age of 55, well, 55 and older. And we can provide them with some adaptive aids and just help them to remain in place. Our goal is to help seniors to be able to stay in the current living environment if that's what they choose to do, not leave their homes because of vision loss. So we're doing that. We have teachers who go out and work with them in their homes. And then we also have an emotional support group that is available on Tuesday mornings. And I'll put the telephone number for that as well. It's manned by a licensed clinical social worker. And it's an emotional support group, and it's for people who are coping with vision loss and just need a support system, and other folks kind of talking with other folks who are going through similar kinds of things. So I'll put that in the chat. And then something else I thought I'd love to mention is we have received a grant for interpreter services. So if someone who is visually impaired and they speak first language, the capability of having some interpreter services paid for as well. So really excited about that.
Wonderful.
And one more request, Jeremy, is would it be possible for us to kind of get like a list of contact list of the people on this call or these calls throughout the last several months, and that way we could just go through if we need to access them in some way or another. For me, with the screen reader, it's hard for me to grab somebody's contact information off of the chat.
Absolutely. And so that is like, I do have all of that information. I as I was saying at the beginning, I am trying to get Walking Spirit to where it is sustainable, and part of that includes getting better technology and whatnot, and a little bit more training for me on how to do things effectively. But I will email you that, James. And yeah, the issue that I have had is in sending out bulk email to lots of folks. I discovered sometimes it doesn't go at all. So I will email you that individually. If anybody else would specifically like me to send them that list separately, please just note it in the chat, and then I will get that to you probably within the next week or two, as I am going on vacation as of tomorrow evening. So, but I will get that out to you guys before the next meeting. So,
Thank you.
yeah, my pleasure.
Hey, Jeremy.
Yes, Krista, how are you?
I know I'm late to the game. James, I missed who you're with. I caught the tail end of your intro.
I'm with Bosma Enterprises.
Oh, love Bosma. I'm gonna try to make it to Dining in the Dark. We just golfed with y'all. We're with Direct Employers Association.
Wow, outstanding. I was there, so it was nice to see you. All right.
There we go.
Thanks for letting me interrupt, Jeremy.
No, my pleasure. And you did just miss me also mentioning the Easter Seals Crossroads Talent Showcase, which you will go into more detail with. So if you would like to take it for a moment and introduce yourself, Direct Employers, and what you guys are doing, that would be great.
Oh, yeah, absolutely. So, and actually our meeting got canceled last week. There was an emergency situation and foreseen circumstance, so we had to cancel the June meeting. So I think I'm actually lined up to host the July meeting for the Indianapolis Disability Talent Showcase, which is part of the Work to Include coalition efforts in Indiana around employment first. And so this group meets the third Thursday of the month from 1 to 2, virtually via Zoom, and then in person at Easter Seals Crossroads there in Indianapolis, to connect employers, providers, VR, and job seekers with disabilities, to create more positive employment outcomes and competitive integrated employment in the Indy area. And we're hoping to spread this model to other sites throughout the state. Myself, I'm with Direct Employers Association, Krista Martin. I'm their disability and community outreach specialist. We are a nonprofit member association built for and by employers. So we have over 1,000 employers that comprise our association there. And we also host a annual conference and membership meeting. You're going to have to excuse me. Some random person just pulled up in my driveway and I'm here alone with my son. So I'm going to have to go to the door. I will come back in a moment.
All
so
right.
Move on without me.
Okay, will do. Thank you. Okay, there's somebody on the screen that just has initials there, KM. Do you want to introduce yourself?
Hi, yes, I am actually subbing for Lauren Perry, Director of Provider Services with Division of Aging. So I'm Christy McCann, and so she could not make it, but she wanted to gather information as to about the meeting and who all was on here and just kind of learn a little bit more. So I am just subbing in for her for right now.
Wonderful. It's a pleasure to meet you. Please enter your info into the chat. I will include you as I send out that more beefy address list of all the different folks who have been part of this over the last year. And we've had some great organizations in and out, which is absolutely the point, was to create something so that the disability community could talk about what's going on within our little niches and try to support one another a little bit better. So thank you so much for being here today.
Of course, thanks.
Any update that you want to share?
I kind of got this tossed at me last second, so.
Okay, very good.
I don't really have any update right now.
That's all right. Just listen in. So, okay. I will go to Carly from the ARC. Would you like to say hello?
Hi there, everybody. As Jeremy said, my name is Carly Shortino-Coulter. I'm with the ARC of Indiana. And one of the things I want to share is that we are part of a Medicaid storytelling project. And so one of the things that we are trying to do is to collect stories from people about their experiences with Medicaid, the good, the bad, and the ugly. And we are collecting both written as well as video stories. And frankly, we're looking for something short. You know, less than 2 to 3 minutes, just talking about the importance of Medicaid in people's lives, or talking about, some of the experiences that they've had. Like I said, both the good and the bad. And this has taken on a more urgent need as Congress is now talking about as they're having budget discussions, and there are some serious conversations going on about cutting Medicaid at the federal level. We need to make sure that we are talking about how vital Medicaid can be to people's lives, as well as ways that we can improve it. So if you work with anyone who would like to share their story, I've put the link through our website in the chat. They can just use their phone and upload a quick little video talking about, what Medicaid means to them, whether it's things like, parents of young kids where Medicaid is the only way that their kids can get the therapies that they need, whether it's individuals talking about how, they're on seizure meds that cost over $1,000 a month, and without Medicaid, they literally would not be able to survive, or whether it's talking about things like, being able to get nursing, being able to have home and community-based services so that they can stay in their homes and not go into a nursing facility or not go into some sort of institutional setting. We'd like those stories. So if you can share that message and help us gather stories, we'd really appreciate it.
Thank you very much. Is there a link in the chat where people can do that?
There is.
Okay.
There is. And I also want to let you know that these stories, this is actually a national Medicaid storytelling project. And so there are partners all across the country, and there are people, there are other entities across the country who may be using them, even if they're from Indiana. That doesn't mean California won't use some of those things. So want to make sure people know that as well.
Very cool. Thank you so much. Anything else from your end?
There are always a gazillion things going on.
Okay.
Well, one of the things that I also want to talk about, I don't know if this is really the appropriate time, with Medicaid unwinding. We have some numbers. So Indiana was able to start removing people from Medicaid effective April 1st. And in that time, more than 100,000 Hoosiers have now lost their Medicaid. More than 85% of those who have lost their Medicaid have lost it due to procedural reasons, not eligibility considerations. So that's things like not responding to paperwork, or not getting appropriate paperwork in, or not getting it in a timely manner. Literally, that's about 85% of the people who have been removed is over paperwork issues. So as you're working with individuals, encourage them to sign up for an online Medicaid account. You can now actually upload materials directly through that portal, which is something relatively new. But frankly, I don't want people losing their Medicaid over paperwork.
Right.
So throwing that out there.
Yeah, that's absolutely the perfect time to add that. Thank you so much. That's somewhat terrifying that that's going on.
Right. And that's just April and May's data.
Okay.
Over 100,000 just in April and May.
And so then do those folks have to get back in line and just start all over?
So part of it depends on the type of Medicaid that they are on. If they are on a traditional form, if they're on anything other than HIP, if they get their information in within 90 days, they will reinstate them and retroactively grant coverage back to whenever they lost it, so that there's not a disruption in services. However, HIP 2.0 does not offer retroactive coverage. They still have that 90-day window where they can easily get reinstated without having to actually reapply. But if we're past that 90-day mark, they actually have to reapply.
Okay.
Oh, and one of the other big things is that any sort of Medicaid cost sharing, whether that's, a CHIP premium, a HIP power account contribution, or even medication copays, those have all been pushed back to January 1st at the earliest. And the state keeps stressing at the earliest. So that very well could change later on. But cost sharing has been postponed.
Okay. Wow. All right, my screen just changed, but going along with the Medicaid theme, I'm going to call on Stephanie Foltz from Socoa.
Yeah, so this is actually my first time being able to attend one of the meetings. Fortunately, I was actually promoted to the supervisor of the Medicaid team at Socoa as well as community outreach. So I have been
Congratulations.
thank you. So I have been super busy with all kinds of work stuff. And so unfortunately, I haven't been able to attend the meetings. So I'm glad I was able to join today. But speaking of Medicaid, we have been making several process changes over at Socoa within our Aging and Disability Resource Center. So we have worked on a process improvement to help individuals access our services more quickly, in meaning that instead of having to go through a two-step assessment process to access our services, it is now a one-step assessment process in order to access our services.
Wow.
So that is not to say that things are moving quicker, because unfortunately we have had a huge hit in staff turnover. So we are unfortunately scheduling appointments to access our services all the way out until the middle of July at this point. But we are actively recruiting employees. So if you hear of anybody that is looking for a job, we have over 68 job postings currently on our website, and we desperately need employees in order to be able to help the community because there is such a huge need. But with our Medicaid team, we did recently make some changes. So I don't know how familiar people are with how our Medicaid team previously operated, but our staff in that department would drive out to clients' homes and help them with collecting paperwork. We are no longer doing that unless it is a special circumstance where the individual absolutely has no transportation, no informal supports that can help them. We are only accepting those individuals on a case-by-case basis, but now we are putting that on the client to be able to get all of their paperwork turned in to FSSA on time, just because our MAT team is only 5 employees and each of them had over 385 clients on their caseload. So it was actually more detrimental for our staff to be doing that with regards to them trying to get access to Medicaid waiver services within a timely fashion. So to help them have the ability to help more people, we did take that drive time out of there as well as collecting documents out of there. So that way we're able to advise and help people in a more efficient manner. So we have made several changes. Hopefully these changes will help benefit the community and give them the ability to access our services more quickly and efficiently. But like I said, right now, because of staff turnover, we aren't as efficient as what we would like to be, but we are very hopeful that with making some additional changes, we will be able to get back within a 2 business day window of being able to have an appointment with us.
Okay. Yeah, I can't imagine how you guys keep up with all of that. Obviously you've heard us talk about the talent showcase that's going on at Easter Seals Crossroads. Hopefully you're connected with them. And even though I don't have anybody here today from Accessibility Center for Independent Living, please make certain they're aware of what jobs you guys have available, because I know they have folks who are looking for work.
I will definitely do that.
Yeah. So if you don't have anything else to add, I will go to Heather Wildred Holman from Firefly.
Yeah. Hi. Good morning, everyone. As Heather Wildred Coleman with Community Partners for Child Safety, Marion County, a prevention program. I'll be sure, I think I've done it in the past, but I'll be sure to share the Community Partners map. I think we have folks on this meeting / call from all across the state, but we're an in-home case management program for anyone who is the primary caretaker of kiddos up to age 17. Predominantly information and referral, but we do use protective factor framework, and we go in and we build upon the various protective factors that keep kiddos and families happy, healthy, and strong. So social connections, parental resilience, social emotional learning, development of kiddos, concrete supports, and we're connecting families to resources and things like that to help them, like I said, be happy, healthy, and strong. So one of the things we do while we're on this call is just gather information and resources to take back to our caseworkers. But we're predominantly here in Marion County, and we've got programs. We have the contracts for about a third, the middle third of the state of the regions. And then there are other agencies who hold those community partner contracts throughout the rest of the state, if you're not familiar with that program. And then for Firefly, as folks may or may not know, I think there's always some new folks on this call, is a merger of Children's Bureau and Families First. We officially merged a few years ago, but we revealed our new name last April. So we're Firefly Children and Family Alliance, and are still operating all those same services that both Children's Bureau and Families First previously were providing. So thanks.
Thank you. I, by the way, am really looking forward to finally getting to meet with Michelle Williams next Friday. She and I
Awesome.
had, I felt so awful. It was one of the rare times when I had an appointment set up with her and I made the mistake of getting into a very what would be the right word, heated email that needed to be sent out regarding a certain accessibility experience. And then when I looked down at my time, I had blown right past the appointment. So she was, and that is not something that I ever do. I felt absolutely terrible about it. She was very kind to extend another meeting opportunity for this coming next Friday, not tomorrow, but yeah. So
good. I'm so glad that you two we could get you connected. I'm looking forward to hearing how that goes.
yeah, thank you so much. So
Yes,
yeah,
thank you.
my pleasure. All right, Courtney from Fuse, would you like to say hello? There you are.
Hi, sorry, it took me a second. I'm trying to multitask badly here. So congratulations on your new journey, by the way.
Oh, thanks.
I'm excited to see what you're going to do.
We'll share a little bit more of that in a little bit.
Okay, I'm excited to hear about it.
Thanks.
I'm Courtney. I'm with Fuse. It stands for Families United for Support and Encouragement. We were started by 2 moms of kids with disabilities, and we're still ran by moms of kids with disabilities. So we have been on the journey, and we provide support, education, training, events, and fun stuff for folks of all ages. We do have a young adult group, so it was started primarily for children, but now we serve people of all ages. So the thing I want you all to be aware of, we are having another Inspiring Abilities vendor expo. It'll be on November 4th on the south side of Indy, and we're registering that for that now.
Wonderful. Did you put a link to that in the chat?
I can do that.
Please do. Yeah. Okay. Anything else from Fuse that you want to throw in before I move on?
Nope, that's it.
All right. So Tim Vermand, would you like to say hello?
I'll say hello. The cat just said goodbye.
I was curious.
She likes to come. Yeah, she likes to come by and see who's on that screen that I'm looking at.
Uh-huh.
I resonated with your talk about how places fulfill the ADA, but not really.
Right.
And I know we've had some discussions on that before. In July, I am leading a discussion group in this book, My Body Is Not a Prayer Request, which is about how that plays out in churches where you don't have to follow the ADA anyway.
Right.
The gap between reality and what you're supposed to do. And if it works well, I will probably have at least some notes and maybe a video that will be shared when it's over.
That'd be great. Where is that book available?
The book is available anywhere.
Okay.
I think. I got it from the library.
Okay.
Marion County Indy Library has it. There's a place you can get a free copy of Leading a Group. I don't know if we have any left over for ours yet or not. I will see what I can find out.
Okay, very good. And Tim, I don't know if you mentioned actually that you are with, it's the Methodist Disabilities Council, is that right?
The United Methodist Disability Ministries.
Okay.
We've been preoccupied in the last month with a group going to Africa and establishing a deaf school there.
Oh, wonderful. Okay. Anything else?
Where
you
they
want to
still
add?
have well, they're combating the way some places, corners out there still deal with what they call witch doctors and extreme levels of prejudice against anyone who's disabled.
Yes. I'm part of a international Rotary Club that's focused on disability advocacy at a global level. And that has been a conversation that we have had about folks who still, yes, portray themselves as witch doctors and are doing horribly disfiguring and torturous things to people with disabilities in an effort to cure them. It's terrible that that is still going on in the time that we live in.
Yes, and it's not always a whole lot better in this country, in some places.
True. Very true. All right. So, and kind of with that in mind, this is the point where I said I was going to steal the spotlight and talk for a little bit. One of the things that I have become aware of in my work to try to make Walking Spirit more sustainable is that the Great Lakes ADA Center has something called the ADA Trainer Leadership Network. Some of you, James and Carly, both got an email from me regarding this. They are looking for 2 candidates from Indiana. I am hoping to be one of them, who will get to go through their training and actually, as a result of going through that training, be given their curriculum to share and incorporate into Walking Spirit's work regarding how to make your operation more accessible for people with disabilities. And it's not so much an ADA certification. It's not going in and looking at all of the legal aspects of the ADA, but more the practical approach that operations need to utilize, why it's important, how do you do it, and standardizing that across this trainer leadership network that goes beyond the Great Lakes area. This actually began 8 years ago, I believe, in New England, through that ADA center out there. And the Great Lakes Center has only done one previous session. This will be their 2nd year doing this training. As I said, they're looking for 2 folks from Indiana who do the type of work that I'm trying to do with Walking Spirit. Not specifically with my niche is kind of going to be hotels and the hospitality industry, because that was my background before I lost my legs and shortly after. But and so, for instance, if say somebody in another area, say out west, needed a trainer specifically focused on hospitality, I would be part of this network and they would be able to reach out to me as that being my niche that I'm doing that training in. Although I've realized I can't just focus on the hospitality industry. I've got to focus on grocery stores and movie theaters and everything else that touches the public sector. But part of what they're focused on is recognizing that underserved populations rarely have somebody providing this training from within their own population. So if any of you know somebody who falls into that demographic, of being part of what would be classified as an underserved population, who is doing similar work, whether it's inspirational speaking or consulting or life coaching, whatever the case may be, focused in the disability realm, please let me know, because I'm trying to help recruit that second person for them if we can. So that's one thing that's going on. The other, I'm going to share my screen because Walking Spirit has had a ridiculously crazy month. And part of that, well, first I'll share the story. Part of that began with part of the wonderful thing that Voc Rehab, them supporting me and developing my business to a point where I can get off of disability benefits, includes them looking at and supporting me with assistive technology. A lot of you know that I walk on a pair of what's called power knees. I've had them for 8 years. They were the first robotic prosthetic on the market, and they're still the only prosthetic that has a lift assist that will help me go up and down stairs. The phase 2 power knees that I've used for 8 years has that stair function, but it's really been like a fun little gimmick for me to demonstrate for physical therapy students. It's never been functional for me to actually get up a flight of steps, because I had to stay within the cadence of the leg as I was going up the steps, and managing 2 prosthetic legs at the same time in crutches made that nearly impossible. I would get up about 3 steps and then the legs would time out. So about a month ago, and I think I talked about this at the last meeting, I got to test the phase 3 power knees. And for the first time in 15 years, I've been an amputee for 17. 2 years into my life as a bilateral above knee amputee, I got a pair of microprocessor controlled legs that did not have the robotics. And I tried to go up the steps at my parents' house, and I got upstairs and I said, okay, I'm never doing this again. When I did the test of the phase 3 power knees, I went over to my parents' house and for the first time in 15 years, climbed the steps and visited my childhood bedroom. That was the difference in the advancement in the technology since then. Yesterday, I thought I was going in for fitting for a new pair of sockets. And so the sockets are what connect the legs to my residual limbs. For years, I have had these carbon fiber sockets that come all the way up the outside of my hips that have been very restrictive. They flare out at the top. So if I was sitting down and I dropped something and I needed to bend down to pick it up, I had this carbon fiber frame digging up into my stomach when I would try to bend down to get it. While they were very secure in regards to holding my legs in place, they were also very restrictive. So yesterday I thought I was going in for just a fitting for what's called a transfemoral socket. It's a new technology that's actually specific or proprietary to the manufacturer of my legs that incorporates a flexible rubber rim. And typically the process of making sockets for an amputee would be something that would be a 2-week period that involves casting, sometimes 3-dimensional images, making a mold of the leg, and then developing the socket off of that. This new technology yesterday, it took about 4.5, 5 hours, but I was able to walk out of the prosthetist's office with my new sockets molded directly onto my hips or my legs. They don't come all the way up onto the hips the way that the previous ones did. So I now have new range of motion that I haven't had for 17 years when I have my legs on. And new flexibility in regards to that flare is no longer there. So I can now bend down and pick things up and do whatever I need to do. And I thought I would share some of that with you. But the other piece of this, when talking about accessibility and people with disabilities and insurance, in the process of working to get new legs, I was transferring from my wheelchair that I use at home about a week ago, and the left arm of my wheelchair broke off. And now the trick here is that my wheelchair is 5 years old, so it's actually due to be replaced. And yet I'm also getting a brand new pair of prosthetic legs. Insurance is not going to cover 2 mobility devices within the same year, so I have to get the wheelchair repaired. I started the repair process, called my vendor, did pictures so that they could order the parts. They were very responsive. Everything's moving along great. And then yesterday, well, actually the day before yesterday, I received a call from their Fort Wayne billing office letting me know that I will have an out-of-pocket expense of about $87 on the repairs. No big deal. This is where it gets weird, but that I needed to pay that out-of-pocket expense before they would order the supplies to make the repairs to my currently non-safe, not entirely functional wheelchair that I use for home use. That honestly sounded to me like extortion of a person with a disability. I've not once in 17 years been asked to pay out of pocket for something before the services have been provided. And that led to a conversation with their general manager, who, you know, I've been a client of theirs for almost 2 decades, and had to experience them saying to me that this is how they've always done it, and me replying, well, no, you haven't, because you've always sent me a bill. This has never happened before. And so I'm in the process of pursuing that with the national organization and also my insurance to find out whether or not they're even willing to play ball if they're treating their clients that way. Tim, you put your hand up, so I'm going to say, go ahead.
Just for information, I've always had to pay repairs in advance when there's a gap between insurance and what's remaining.
Right. Well, you've had to pay it in advance before the repairs have been made?
Before they'll even order the parts.
That, okay. And that doesn't make sense. And that is something that it may be an uphill battle, but
yeah,
I'm going to fight to change, because that's not the way it should work. And so the trick here, so when I spoke with the general manager, I was getting in my car to go down to what I thought, like I said, was going to be a fitting, but then found out that I was actually going to get the new legs. So the new legs, the bill on those is over 100,000. My out of pocket is going to be my full deductible for the year, which means by the time the repairs are made to my wheelchair, their anticipated out of pocket for me is not going to be the $87. It's going to be $0. So that is why you shouldn't be paying that up front, and it just creates more challenges and more work for folks to issue refunds, and people with disabilities who are already living on limited income having, you know, to wait for a refund for something they shouldn't have had to pay in the first place. So we'll be pursuing that, but I wanted to share my screen with the last 10 minutes because I thought you guys might enjoy seeing this, assuming I do this right. Here we go. Share. Okay. You guys should be able to see my YouTube channel. And so first, let me show you the test. Hopefully you guys can all see this. Maybe I'm asking my computer to do more than it's able to do. Hang on. Well, where is my YouTube? This may not work. Oh, here we go. It's just moving slower than I want. So this is actually the test of using the legs to get up the steps. And I got to mention, My parents' house is over 100 years old. The carpet on their steps is actually, here we go. The carpet's a little bit loose as it wraps around the bull nose of each step. So I had to be a little bit careful. See there. So this is the first time I've done this in a very long time. I'm not yet fully using the leg the way I should. But yes. And there you hear my wife and my mom. So on the landing, I have to reinitiate the stair ascent mode. So there you go. So that was stair ascent. Now, how do I get out of this? Hang on, stop share. Let's do. There we go. Good, I didn't get rid of you guys. So if you're finding this interesting, okay, let me show you what coming down looks like. There we go. And so coming down, I had to be a little bit more timid because of that loose carpet as it wraps around the bull nose of each step. Give it a second. And if anybody has questions as we're doing this, please feel free to ask. And to kind of let you know how it's going, as soon as we're done, I actually have to put on the new legs and take them back to the office because strangely, the sit to stand function, which worked great in the office yesterday, stopped when after they tightened everything up. So something got changed. Well, the thing being, how many times have you seen me get stuck? And so the stair descent function I would use on a regular basis because it's easier to utilize, but my legs would pause and I would get stuck in the middle of a flight of steps and not be able to get the leg to let me down to the next step. These, while it still is work.
Carpet, well, the other place had really thin carpet.
Yeah, I didn't have to go as slowly.
Yeah.
Where it rolls over the bull nose.
Mm-hmm.
But I'm not having any issues getting. So this, honestly, this is a game changer for me, which is really exciting. So, okay. It's just so consistent in it. Here. So that was the stair descent. And then just so you guys can see what walking and the sit to stand function looks like when it's working right. This is yesterday after doing all the adjustments, and there's a lot of adjusting to make certain things are aligned properly. But so this is what yesterday looked like. And the plan now, like I said, I have to take them in today so that we can access the programming and look and see what's going on, why after they after we did this walk that you'll see here, when my prosthetist then took everything apart to Loctite down all of the screws, it it wouldn't let me stand up like that. But
Because you're on camera.
yeah, you see how easy that was, though.
I'll go right.
Notice how different my left leg is, that it's the amputation is higher, so there's more to connect it, but it's also, you'll see when I turn, the knee is actually offset so that it is behind my left leg. That's an accommodation that was done due to a contracture in my hip.
We got it dialed in.
And yeah, these are much easier to walk with and lighter than the current ones.
Good job, buddy.
So there you go. So that is the phase 3 power knees. Thanks for bearing with me for a few minutes and letting me show that off to you folks, but I thought you might enjoy seeing that. Any questions? Anything anybody else wants to add in before we wrap up for the month?
Just want to let you know I didn't get kidnapped.
Okay, I'm very glad to know that. Did you have anything else that you needed to add?
Oh my goodness. Well, I put my email in the chat if you're interested in attending the Indianapolis Disability Talent Showcase with us in July, which I believe is going to be Thursday, July 20th from 1 to 2. Like I said, via Zoom or in person at Easter Seals Crossroads, just let me know. And happy to connect and provide free resources for our providers and other ways to improve and increase positive employment outcomes. So
wonderful. Thank you, Krista. And speaking of July, which I did not know this until a few days ago, July is apparently Disability Pride Month. So
yes.
So yeah, hopefully everybody's incorporating that into what they're doing. And if I can be of any service between now and the 4th Thursday of next month, let me know. Otherwise, I look forward to seeing you all in July.
Jeremy, let's plan on getting together for something for next month. It's also the ADA anniversary on July 26th. So.
Oh, okay. Very good. We absolutely can do that. Wait, does that wind up? I haven't looked at the calendar. Does that wind up being the date?
I think it's a Wednesday. I think Starklaw Disability Institute
Okay.
is doing a thing for us that day, but I want to connect with you.
Yep. So we will be the day after. Yes. So that's good. Yeah, absolutely. I am going to be on vacation starting tomorrow evening until July 2nd. And then after that, I will try to push out to you guys all the contact info for everybody, information from the chat, invitation to next month. And Krista, just let me know when you want to get something on the calendar. My first 2 weeks of July are fairly flexible.
Awesome. I'm going to go be semi-fashionably late.
Cool. Wonderful. All right. Thank you all. I look forward to seeing you next month if nobody has anything else that they want to add.